Hello, everyone. I hope you all are well and healthy. I'm happy to contribute LP's virtual law review with a comment. Before sharing my comment, I would like to thank to everyone, but especially Professor Silva, who made this project available. So let's start with a question. Who is the global guardian of public health? On 31st December 2019, WHO was informed of cases of pneumonia of unknown cause in China. A novel coronavirus was identified as the cause by Chinese authorities on 7 January 2020. Coronaviruses are a large family of viruses that cause illness ranging from the common cold to more severe diseases. A novel coronavirus is a new strain that has not been previously identified in humans. The new virus was subsequently named the COVID-19 virus. On 11 March 2020, the rapid increase in the number of cases outside China led WHO Director General to announce that the outbreak could be characterized as a pandemic. During this period, the World Health Organization, WHO, has become the focal point of debates all around the world. That's why I think an assessment shall be made about the structure, duties, and responsibilities of the organization. The Constitution of WHO was adopted by the International Health Conference in 1946 and entered into force on 7 April 1948. The World Health Organization is a specialized agency within the terms of Article 57 of the Charter of the United Nations. The functions of WHO are listed on Article 2 of the Constitution of the organization. When briefly examined, it can be observed from the said article that WHO is an international organization to promote, to propose or assist providing health-related issues in cooperation with scientific and professional groups or agencies and governments. So we can easily realize that WHO does not have a formal responsibility or liability as the national governments. On the other hand, on paragraphs A and Q of Article 2 of its Constitution, WHO has two important functions, which are to act as a directing and coordinating authority on international health work and to provide information, counsel, and assistance in the field of health. As can be observed from these functions, WHO's announcement of coronavirus disease as pandemic after 3 months of first reported cases can be criticized as overdue. Before discussing these functions and efficiency of WHO's work, I think it's important to explain the PIP framework of WHO. From the publications of WHO, we found out that PIP framework, which I will explain later, came about firstly with the emergence of avian influenza, or known as bird flu, in 1997. These developments raised concerns that a new human pandemic virus might develop. Thus, these concerns accordingly increased during outbreaks of human H5N1 influenza in 2006. In 2007, WHO and member states came together to start negotiating and interacting with industry, civil society organizations, and other stakeholders over the next 4 years to draft this framework. The PIP framework was unanimously adopted by the member states of WHO during the World Health Assembly on 24 May 2011. As published by WHO, the Pandemic Influenza Preparedness Framework, or PIP framework, is an innovative public health instrument that seeks to better prepare the world to respond to pandemic influenza. Influenza pandemics are unpredictable but recurring events that can cause severe social, economic, and political stress. Preparedness requires a whole of society approach to ensure that when the next pandemic strikes, all countries in the world working in solidarity will be able to respond rapidly and effectively to reduce morbidity and mortality. But at the moment, we cannot say that if the PIP framework works properly or not. But at the same time, I'd like to explain with the publications of WHO that preparedness Planning should occur at community, national, and international levels. Does it work or does it occur? We cannot say at the moment, I think. At national and community levels, essential elements of preparedness include early warning systems, a strong laboratory work, and functional health systems with well-trained people able to recognize and manage potential pandemic influenza as it emerges. An emergency response system also, where regularly tested, supported, and supplied to respond rapidly and effectively. Countries also need to prepare to participate in the international dimension of the response and be ready to work collaboratively within the global architecture. This is where the PIP framework should come into play. It's a partnership between all the major players able to make the international response to pandemic influenza flexible, effective, and equitable. If we return back to the title of this work, now can we ask who the global guardian of public health is? Who is and cannot be expected to fight against coronavirus alone, but with national and international authorities. The WHO is not the enforcing body of health regulations, nor the authority to enact regulations for its members. However, after coronavirus disease announced as pandemic, WHO has attracted attention of the whole world. This attention led to the criticism of its work. I can admit that I agree with most of those critics, but at the same time, I feel like if there shall be an authority to count on, then it might be the WHO. I have also thought that a fresh start with a new organization or leaving the membership cannot be the perfect solution when looking back to work and experience of the organization over years. As noted by the editorial board of New York Times, I believe that the organization is still the world's best hope for fighting pandemics, even if you feel like all this work is on paper. On the other hand, whose assessments and declarations were left behind scientific opinions during coronavirus pandemic. For instance, WHO announced that transmission of the virus by people without symptoms is very rare was a misunderstanding after pushbacks from scientists. Also, a growing body of evidence suggesting otherwise. WHO has said that small airborne droplets or aerosols are not a significant factor in the pandemic spread. It is then officially acknowledged that droplets carrying the coronavirus may be airborne indoors, and that people who spend long periods in crowded settings with inadequate ventilation may be at risk of becoming infected by the organization on 9th of July. The organization has not endorsed wearing masks till the beginning of June, claiming that there was too little evidence that they prevented transmission of the virus. On the contrary, many scientists and governments have been recommending masks for months. For instance, wearing masks has become mandatory in the major cities of Turkey by April, and today the administrative fine of not wearing a mask is 116 euros. From above examples, can we say again, who takes a cautious approach to evaluating scientific evidence? A track record of responding to emergencies is uneven, to be sure. The organization's response to Ebola outbreak, for instance, in 2014, was criticized as slow-footed and uncoordinated, even to the outbreak severity. But who has worked to correct its course in recent years? While the organization's mistakes in its response to the coronavirus pandemic, those mistakes are seen as a far cry from the obfuscations that the US administration has accused the organization of. Of course, there are problems that ought to be addressed by WHO. The scope of its mission is seen as outgrown its budget. Also, the organization's strict directives continue to undermine its successes. And World Health Organization is still, for all its achievements in the past 70 years, is a cracking bureaucracy. Before concluding my short review, I would like to acknowledge that no organization or agency at national or international level is perfect. Fighting for coronavirus pandemic needs national unity and global solidarity, whether we are for or against the work of WHO. Thank you for listening to me.